Hey Coach, it's Alyssa here. Thank you so much for being very flexible and letting me do a video instead of trying to get all of this out of my head onto paper. For one, this past couple, really since December, it's been quite crazy with the new job and the way it's taking off and kids and life and yada yada. So thank you. I really appreciate it. So I have the questions printed out here and I have a ton of notes here. And then when I'm done, I'll send you my sources that I got the information from. So to get started, we were talking about the marine-based omega-3s and how they work in the body and why we might ask your particular clients to take that supplement. So the marine-based omega-3s specifically, those are containing that DHA and EPA. So those are the fatty acids or the good fats. So those have been shown specifically to really benefit overall health. So for instance, I have down here like our cardiovascular health, and they're really, really useful for our muscle cells, and they allow them to be more sensitive to insulin, and it allows more nutrients that can be used by muscle tissue. They provide benefits to our nervous system functioning and brain development. So they keep cell membranes relatively fluid. That way they allow those neurochemicals to pass through as needed. And then they are very essential for cell repair and growth. And then for our immune health as well. So they have been found to block multiple pathways of inflammation. So there's a whole list of benefits that the omega-3s are good for. And based off the information that you gave us on the case study, most of PN's typical clients, where did I have that in my notes? I thought I had it written down somewhere. Sorry, I'm still reeling from, I worked all this weekend. The particular client that I would see at PN had, I think it was like 46 to 56% already had some sort of health related disease and heart disease, inflammation, autoimmune diseases. So this is definitely something that could benefit that population. There's two studies that I found in particular, and I have the notes on them here. So both of them were done at Harvard Medical, and there was one where they included over 25,000 participants. This one included all healthy adults who didn't have a history of any cardiovascular diseases. And it was done by a, do I have her name here? Professor of medicine at the Women's Health at Harvard Medical School, Dr. Joanne Manson. They found in their study that a moderate dose of about 1 gram did not significantly reduce cardiac events. So cardiac events like heart attack, stroke, blocked arteries. However, they did find that it did produce or it did reduce cardiac events by 19% in those that are not getting at least 1.5 servings of fish into their normal diet. And then it also found that it reduced events by 44% in African American subjects. So my second trial that I found, they used 8,000 people. However, and they were about middle age, so they were between 50 and 60 years old, the people who were included in the study. However, these people had already experienced a cardiovascular event, or they're at a high or significant high risk factors for one. For this one, they used a higher dose. So they used 4 grams of omega-3. And they found that a 25% reduction in the risk of dying from a heart disease or suffering an event at that high dose. So they found if they had already suffered some sort of cardiac event, that doing a higher dosage had great benefits. They did back that up with high doses are not for everyone. So specifically, people that can pose a risk if they're already on blood thinners or producing abnormal heart rhythms. So that's not for everyone. So that was 2 studies that looked at giving like the moderate dose, that 1 gram, versus a high dose at that 4 grams. And that omega-3s that they used were marine-based, and it was the EPA, had a mix of EPA and DHA as well. So I thought that was very, very interesting. So I feel like that is one reason why PN did recommend the omega-3s and this particular dose of omega-3s, because there is benefits behind that. Let me see what my questions are here. So yes, I believe it is appropriate for Precision Nutrition to recommend that supplementation based on that data. And also, one of the reasons most of the people that you're seeing, like we said, is like a level 1 client. And so for them, they're not really having the most balanced diet. That's usually a little, what was it? There was another stat that I found. Because we can't make the omega-3 fats, we have to get them from our diet. And I'll include this in my sources as well. But for our cells, I guess, compete for space between the omega-6 and the omega-3s. And what they're finding now is that balance is way off because of our modern diet. So we have our omega-6 intake way up here while our omega-3 is down here. And the reason why we have so much of the omega-6 is because it's found in like the plant oils and factory raised animals. So individuals today aren't getting those marine-based omega-3s that they're really needing to help balance their health and really have their body work efficiently like that for them and see the health benefits of it. So I guess in a very unorganized way, that's my thoughts on why you guys recommend the omega-3s, and that I do believe that that is a good reason too. Now the probiotic one, no, coming back here we go. So I guess me with working with the client, and like I do at work as well, it would still be very important for me to try to recommend people get this omega-3 through diet. So if they can aim to eat 2 to 3 servings of fish per week, that would definitely be more recommended. But it's like the case that we talked about in our lessons about the house being set on fire and you're mowing your lawn. It's one of those things that they're already not doing things too consistently. So what's to say that they're going to be taking this supplement consistently? So we would rather back that up and really work on the habits of getting that intake through their food, through their meal plan. And then we have the case of people who, vegetarians, or people, there's a lot of people now allergic to fish. So recommending that algae-based supplement instead. But again, no dietary supplement is a substitute. So that's how my personal feelings are on there. So I guess it would go either way. I would rather them getting through the food sources. However, if they're not consistent with that, but they can be consistent with taking a supplement, then that would be a route that I would rather recommend. But again, really trying to work on getting that in through the intake of food. The probiotic one was a little bit trickier for me because right now I'm reading that Happy Gut book, and it's just one of those things that is so huge and complex for me, but I'm still having a really hard time really understanding. I mean, our gut health, it can just affect so many things, and the crazy of how large it is and how much we really don't know about how it affects the rest of our body. I mean, there's already so much information that we do know that it can affect. For instance, like the, digestion of food, absorption of nutrients, maintenance of the immune barrier to the outside world, the good bacteria versus bad bacteria, detoxing. There's just so much about how our gut can actually influence our body and our mood, physically, mentally, everything. To me, it's still very complicating, but I'm very intrigued with it. What were our questions? I'm totally getting off post. Here we go. I believe it is appropriate to recommend this type of probiotic simply because of the way, again, our culture is and the way that our diet. We don't have a lot of foods that are going to be supporting that good bacteria. In fact, it's quite the opposite. We eat mostly foods that are complementing the bad bacteria and allowing them to flourish and to grow. So having a poor diet, we're having diets high in sugar, preservatives, alcohol, processed foods, overeating, inadequate fiber, stress. We were one of the most stressed out generations of all time. And then all the medications that we use too, and the antibiotics that are just handed out like candy. So I believe we use probiotics in my house. I have a son who is ODD, as well as falls very on the borderlines of the spectrum. And for me, part of his treatment is a quality probiotic. And I have seen crazy improvements in his behavior, in his mood, and his control since changing his diet and adding in that probiotic, but also reducing some of these foods that are aiding the bad bacteria essentially and throwing his system off balance. So again, this is something that for me, we all supplement with a probiotic, especially my son, because he's one of our picky eaters. He definitely models a lot of a typical American diet today. It's very high carb, processed, sugar. I try not to, but again, he has issues with texture, and it's a whole other story with him. So I would still recommend the probiotic, trying to get most of that through foods. So my husband is Korean, so one of the ways we do, and actually my two other kids, we eat kimchi. It's one of our favorites. I know it's not for everyone, but my daughter is a huge yogurt fan. So we do lots of yogurt. And so this is stuff that I would recommend people, again, just like the omega-3s, would try to do. Try to get it in through diet first. If not though, then definitely I would recommend adding in the supplementation that PN does for their clients. And again, the same reasoning with omega-3s, just to help support their diet. And so one of the citing sources that I have is of what happens in our GI tract can affect our immunity, lungs, skin, and so much more. And so there was a study done about how, and I think this was supported in our lessons as well, but the obese show less biodiversity, so higher levels of the bad bacteria, and that can lead to insulin resistance and inflammatory activity. So again, that is mostly that population that you guys showed us in that information as well. So I can definitely see why you would make that as a recommendation for supplementation. I think that is all the notes that I have. Again, I'm really sorry that this was all over the place, but my brain is pretty spread thin right now with work. Let me know if there's anything that I missed. I would be happy to follow it up with. I know this wasn't the greatest explanation of my thoughts and how to get them out, but they're out. They might not be organized, but they're out in this video now. So thank you so much for your time, Coach. Have a good day.